Hello everybody and welcome to today's webinar. We're going to be talking about methodologies for measuring impact today. My name's Helen Chatterjee and I'm a Professor of Biology at UCL.
And my name's Nuala Morse and I'm a lecturer in Museum Studies at the University of Leicester.
So to kick off today, let's think about evaluation in relation to health and wellbeing. What is it and why do it? We're also going to be thinking about ways of measuring wellbeing. There are many different ways of measuring wellbeing. We'll just give you some examples today with a focus on psychological wellbeing. And then we're going to end up with a couple of case studies, one which Nuala will lead and one which I'll lead. So first of all, let's think about evaluation and also the difference between evaluation and research. So evaluation is a process to find out whether a project has met its aims and a set of objectives which you've identified, and in particular whether those objectives have met particular outcomes and impacts. And that could be both positive and negative impacts. So for health and wellbeing, that means looking at things like emotional or psychological health and wellbeing, physiological, physical, and also social outcomes linked to the particular museum activities that you're running. This is quite different from research, which is an academic inquiry focused mostly on using standardised methods and approaches and particularly advancing more generalisable knowledge and theory as opposed to the more project approach that we see in evaluation. So it's really important to think about why do evaluation. Of course, there are lots of reasons for doing evaluation. We might want to know how many people took part, did they enjoy those activities, how the activities could be improved, were they efficient, were there any unexpected outcomes. But we're particularly interested in this context, what the benefits are for participants in relation to health, well-being or quality of life. But it's also really important to think about who you're doing evaluation for in the context of why do it in the first place. So you might be interested in doing it for finding out whether your audiences have met the objectives that you've set. Have the outcomes that you identified been met? Have your participants had good outcomes? And how can that inform your approach to running your programmes? Your organisation might be interested in evaluating the activities that you run. That could be for advocacy, to inform strategy, to get more funding, to improve provision for those audiences more generally. And funders also want to know that the programmes that they funded have been effective and you want to demonstrate that you've learnt from it and met those objectives. And then finally, the health sector, the people that you might be seeking to improve health outcomes, might be interested in showing that you have actually achieved those outcomes for those participants, again, that you've identified. A key thing that's emerging in relation to evaluating health and wellbeing is the notion of co-production. And that's particularly important because we want to understand how those participants feel about the impact of programmes on their own health and wellbeing. So it's really important to get their take on how the programme should be evaluated, what they've gained from that programme, and feed that into the sorts of methods and the data and the way that those data are analysed. But also all the other stakeholders are involved. So that's the people who've been running your sessions and facilitating those sessions, whether it's museum professionals or artists, any partners that you've been working with. That could be third sector partners, charities, organisations like Mind or Age UK that you might have been working with, and also any referrers that you might have been working with, health and social care partners. So it's really important to get everybody's take on what it is that you're trying to get out of that programme in order to understand whether those objectives have been met for you, for the participants and all of those different partners. And that's what genuinely co-produced research is.
In the second part of this webinar, I'm going to introduce you to some different approaches to evaluating health and wellbeing impacts and look at some commonly used measures. Before we start though, just a note on wellbeing and what we mean when we're talking about wellbeing. So there's lots of definitions out there, but here I just want to refer to wellbeing as both a combination of feeling good and functioning well. So it's about how people experience their lives and it has multiple dimensions. There are two broad approaches to evaluation that I want to talk about today, and the first one is qualitative evaluation. Qualitative evaluation is really important in health and wellbeing projects because it enables you to capture people's own perceptions of their health and their well-being. And that's really important in understanding the benefits that they're deriving from taking part in museum activities. There's a number of methods you can use here. The first of them is participant interviews, but also you might consider doing group interviews or focus groups. And another approach is to use diaries. So giving participants a diary where they can record their feelings across the, say, 10 weeks of your museum activities and we'll talk a little bit more about those in the context of the case studies that we want to present later. A second approach to evaluation is to use quantitative methods. So these are often used in health research, specifically using validated scales. So here you're collecting data in a numerical form, and so you'll tend to report on this data through graphs or charts or tables, as you can see on this slide. With quantitative data, we would advise using a pre and post study design. So what I mean here is that you're collecting your data at the beginning of a programme and before the programme starts, but also at the end of a programme. And in this way you can compare those health outcomes across that time frame. And I'll talk about this through the specific case studies as well. I want to talk you through some specific measures that are used in health research to look at well-being. The first one is PANAS, and this is the Positive Affect Negative Affect Scale. PANAS is based on the idea that well-being isn't just the presence of positive affect, but it's also the absence or reduction in negative affect. So it's looking at well-being as a multidimensional concept. The second scale is a visual analogue scale. So this works in a similar way. Here you can see that the scale goes from 0 to 100, with unwell at the bottom of the scale and well at the top of the scale. And here the participant would be asked to simply mark with a cross or a line how they feel on that scale from 0 to 100, from unwell to well. And this methodology has been successfully developed for working with people with dementia through the Tunbridge Wells Dementia Toolkit. The next measure is the UCL Museum Wellbeing Measure. This measure was developed specifically to capture the well-being impacts of taking part in a museum session. So it's based on the concept and the idea of PANAS, but it was developed specifically for museums. So on the umbrella, you'll recognise some of those words. And here again, the participant would fill out the umbrella by choosing, for example, in relation to inspired, how do they feel from a scale from 1 to 5? Do they feel not at all inspired or very inspired? And here again we would use a pre and post study design, so that you would ask participants to fill out the umbrella at the beginning of the museum session. You could ask them to then fill it out again at the end of a 2-hour activity, or you could use it by asking them to fill it out at the beginning of a programme and then at the end of, say, a 10-week programme. And again you could compare those measures across time. Another scale that's often used is the Warwick-Edinburgh Mental Wellbeing Scale. So this looks at mental well-being, and here participants are asked to look at each of the statement on the form and to respond to how they feel in relation to that statement over the past 2 weeks. So for example, the first statement, I've been feeling optimistic about the future. Would you answer none of the time, rarely, some of the time, often, or all of the time? And participants go through each of these statements, and then you can derive an aggregate score. Here again you can look at it over time, so at the beginning of a programme and at the end of, say, a 10-week programme. You can also use observational scales. So this is the ARTS observation scale, and this was developed for hospital patients. So here you can observe how people present in relation to their health and their well-being. So with this scale, you can derive a happiness score, and you would establish this both at the beginning and at the end of the session to look at the impact. So for each patient, you would look at them individually and then record how they present in relation to the scale above. So the smiley faces from 1 to 7. Do they appear visibly frustrated, or do they appear excited and delighted? And from this you can derive a happiness score on this scale. You can also look at other dimensions through this scale, so whether the session has successfully distracted people from their clinical environment and whether they've had an enjoyable time. So in this final part, Helen and I want to run you through 2 case studies of research projects that we've been involved in. The first one is called Not So Grim Up North, and this was a research project funded through the Arts Council for England. Our museum partners for this project were Manchester Museum and Whitworth Art Gallery and Tyne and Wear Archives and Museums. So the project aims for Not So Grim Up North was to better understand the health and wellbeing impacts across a series of projects and programmes that the museums were already delivering. So this included museum programmes in hospitals, working with adults living with dementia, but also with stroke patients. It also included museum outreach programmes, working with stroke survivors and individuals with an acquired brain injury, as well as mental health service users. Although the programme involved a range of different audiences, we used a mixed methodology across all the programmes to capture those health and wellbeing programmes, so both quantitative and qualitative evaluation. In terms of a quantitative evaluation, we used the UCL Wellbeing measure, and we used this at the beginning, middle and end of a programme. So some programmes ran for 6 weeks, others ran for 10 weeks, and in each case we would capture that data at the beginning, middle and end. Where possible, we also did 3 and 6 month follow-on data collection. And for those situations where it wasn't possible for people to fill out a questionnaire because of poor health, and this often happened in the hospital context, we devised a systematic observation approach to those programmes. So for the project, we also used a range of qualitative evaluation to really get at how people feel about their health and their well-being, and the value that they derive from taking part in museum activities. So this included diaries with participants, facilitators and researchers, and it also included a series of end-of-project interviews with all of our partners, so with our participants, with the museum facilitators, and also with the health and social care partners who were involved in the project. So I just want to give you a brief overview of the findings of this project. Across all the programmes, we found that there was a positive impact of the museum sessions in terms of psychological well-being and people's mood. And specifically, we found that the element of social connection was really important in how people described the benefits of a programme. So being together with others was really important in supporting well-being. For the project that involved stroke patients, we've developed some exploratory research here around the potential of object handling in physical rehabilitation and occupational therapy. So here specifically around the rehabilitation properties of object handling and how they might support occupational therapy in relation to upper body rehabilitation. In relation to the project that we did with people living in dementia in a hospital context, this really adds to the evidence around the value of museum object handling in person-centred care. So not simply or not just about reminiscence activities, but also the importance of doing creative cultural programmes and the impact that they can have as a really meaningful activity that can support well-being. And in relation to the project and the research that we did with mental health service users and stroke survivors, here we explored the value of museum sessions for people's sense of recovery and their sense of belonging.
So for our second case study, we're going to talk about another project where we used a range of different methods to assess the impact and the efficacy of the Museums in Health programme. This project was called Museums on Prescription, and it was a research project funded by the Arts and Humanities Research Council that we ran for 3 years with a whole range of different partners that you can see here on this slide. And the idea of this project was really testing the idea of how museums could play a role in social prescribing. And social prescribing is the notion of linking patients with sources of support in their communities, in this case museums. And here we were working with socially isolated, vulnerable and lonely older adults. And those older adults had been identified for us and referred to us from partners like health social care partners like adult social care, psychological services and third sector partners like Age UK. So as part of Museums on Prescription, we worked with 7 different museums across London and Kent. And you can see here from this slide, we've got a whole range of different partners, from big national organisations like the British Museum through to smaller local authority organisations like Tunbridge Wells Museum and Beanie House and Art of Knowledge in Canterbury. And each of those museums ran a 10-week programme for us, and across those 10 weeks they did a whole range of different activities. Everything from museums, object handling activities, collections-based activities. We had creative writing, we had some poetry, singing, we had people making exhibitions, co-curating exhibitions, producing guides for older adults. So a huge range of really creative activities going on across the museums, across 10 weeks. And across those 10 weeks, each group of participants of about 6 to 10 older adults worked for about 2 hours in each of our partner museums. So again, in this case study, we used a whole range of quantitative measures, including the UCL Museum Wellbeing Measure, the Warwick Edinburgh Mental Wellbeing Scale, and a special measure designed for looking at loneliness. And we took those measures at week 1, week 5 and week 10 at the end of the programme, and also we did some shortened version of the Warwick Edinburgh and the loneliness scale at months 3 and 6. And again, a mix of qualitative evaluation from diaries and individual passports where the participants themselves collected information and ideas throughout those 10 weeks and in follow-up, diaries from the facilitators and the researchers, and the usual mix of participant interviews, facilitator interviews, and some focus groups, and lots of video and photo information as well. So in this slide you can see some of the results from the quantitative data that we've got. This is looking at the data from the UCL Museum Wellbeing Measure, looking at psychological wellbeing, and what we can see on the left-hand bar chart is on the left-hand side in pale green is the baseline score. So for all of the museums, for all of the participants, what was their baseline score for their perception of psychological wellbeing, and then we can compare that to the same measure at the end of the 10 weeks. And what we can see is an increase across those 10 weeks, which is statistically significant. And on the right-hand side, you can see that those scores for each of the individual museums. And you can see that for all the museums across all of the settings, that we see an increase in psychological wellbeing. And as you've heard, we've had some great qualitative data out there to look at, and so a really great wealth of information in order for us to do a really detailed, comprehensive qualitative analysis. And here we used a grounded theory, thematic approach to identify different themes emerging from all of those different sources. And again, like the Not So Grim project, you can see some of those themes appearing here again, that real sense of belonging and how museums can contribute to improving sense of belonging, quality of life, the idea of learning and acquiring new skills, which is really important across the life stages. And importantly for this group, having something great to look forward to, something which is social and something which is creative. And what we saw is that this changed into a lifestyle change for those people, thinking about museums as a new venue to go to improve their lifestyle and improve their healthy approach to living. And across 10 years of museums and health research, we've seen very similar sorts of outcomes, no matter what the activity or what the group that we're working with. And I won't run through all of these now, but you can see some of those themes appearing again here, that idea of learning and continuing to stay engaged, to be stimulated, to have positive psychological support through doing community-based activities. And museums are just a great place to offer those sorts of activities. So just to finish off, there's a whole range of different resources out there that we can guide you to help you in your evaluation. The Creative Incredible project has got some really great ways for evaluating arts and health projects, so there's some good guidance on their website. The What Works Wellbeing Centre have been doing fantastic work around understanding what we mean by wellbeing, and as you've heard, all the many different ways of measuring wellbeing, and there's some guidance here about thinking about measuring wellbeing and how that relates to your activities. Then there's various projects that have looked at specific ways of measuring wellbeing in relation to specific health conditions or for specific target groups. Here's just one example from Queen's University in Belfast, where they've done some work around evaluating arts-based programmes for people with dementia. And then the case studies that we've talked about today, Not So Grim Up North and Museums on Prescription, there's lots of great information on our website, and also information on the Alliance website about all the different great projects that have looked at measuring wellbeing in relation to museums and health. So thanks for your attention, and we hope you enjoyed it. So there's a really good question about how you can undertake evaluation when you're a small team and you're already overstretched. And I think here it's really about that theme of why you're doing the evaluation and who is it for. Do you really need to do it? Is it to improve programme design? In which case then maybe a small scale evaluation is all you need to understand the impact of your programme. Or maybe it's for your funder.
So to add to that, it's about looking at the funders and looking to build in an evaluation budget into the grants that you're applying to. So you can do evaluation internally with your own teams, but if you're overstretched, do consider getting external help. So that might be from an evaluator or by doing partnerships with researchers.
So So this is an interesting question because it comes up a lot because so many museums are doing programmes with people with dementia. So how can we evaluate those sorts of programmes? And as you've heard today, there are some examples of specific approaches for measuring wellbeing with people with dementia. So for example, the work that Queen's University Belfast have done. Within the UCL Museum Wellbeing Measure, we actually co-developed a scale specifically for people with dementia, and we co-produced that with people with dementia and their carers.
Another scale to look at, which is based on a visual analogue scale, is the work that's been developed by Tonbridge Well Museums. So they have a dementia toolkit, and in it they explain the methodology that they've developed. I think what's really important is to co-produce, and also to not think that people with dementia definitely can't answer your questions or can't be interviewed or don't have anything valuable to say in the context of an evaluation. So sometimes observational methods are more appropriate, but to always remember to work with participants and get their views in relation to the programme and what they've got out of it.
So an interesting one about one-off museum sessions or one-off museum activities and how you can evaluate those. And of course there are the standard museum studies approaches, so audience research, visitor surveys. You can think about incorporating a wellbeing element into those sorts of approaches, and more extensive research approaches like instantaneous sampling or more detailed behavioural observation. But again, I think it's important to think about why you might want to do that, and if it's to improve those individual activities, then you might want to do some more in-depth work on those activities with a group of participants around the efficacy of those particular activities in relation to wellbeing outcomes. And that's where you might think about using some of those sorts of methodologies we've talked about in today's webinar.
Yeah, so to add to that, I suppose, we've talked a lot about pre and post-study design, so capturing data from the same people at the beginning and end of a programme. But that's not the only way to do evaluation, and as Helen says, you can do these on the spot, capturing people's feelings and their emotions from taking part in your event. What you might also consider is using a consistency of questions. So if you insert a wellbeing question into your visitor survey, use it over a long period of time, use it over a year. So although it's different audiences, it's a similar type of event, and you might look at those responses over time and get a picture of how your museum is contributing to community wellbeing.
A really good question about standardising measuring wellbeing, which is a big topic for anybody interested in health and wellbeing. And the answer is yes, it would be really great if we could find a standardised way of measuring wellbeing. I guess the biggest issue is how do we agree what that standardised approach is? And I think that's particularly interesting for us within the museum community because we know that our programmes are quite varied and we're doing different sorts of activities with different sorts of audiences. So standardising that, I think, can be challenging. We've talked about some methods today which are attempting to do that. And I think for your own approaches to evaluating wellbeing, it's thinking about it in the context of that programme. What's the best way to evaluate it in relation to those particular activities that you're running, and in relation to what your audience has the capacity and you have the capacity to undertake.
And in relation to that, I suppose, it's also with your programmes, consider using the same measure over a long period of time. So consider using the same measure for 2-3 years and sticking with it so that you can get that long-term view.